Hey everyone, this is Arya,
And this is Josiah.
and today we're going to do something a little different than what we normally do. We're going to go look at some high yield step two and shelf images that you'll come across throughout third year and your step two exam. Today we're going to focus on peds and some stuff you'll see on your peds shelves. And Josiah and I, not too long ago, having taken these exams, we figured it might be something helpful for y'all to see. All right, let's get right into it. The first one we have here is a foreign body ingestion. One of the most commonly tested kinds of foreign body ingestion is the button battery. So this is what you see here. When you see this on an exam, you immediately want to select emergency endoscopy, just because button batteries can cause necrosis of the tissue, and it's really something you want to look out for, and it's usually emergently managed. You also want to do that with sharp objects as well too, because they can cause so much damage when going down through the digestive tract. But for other objects, you typically want to just manage conservatively. You kind of watch across 24 hours and see how it progresses. So look out for this one. Another one that we saw commonly when studying for our ped shelf was duodenal atresia, and it commonly causes this double bubble sign where you see distended stomach and duodenum. They test this one a lot and they love it, and they also kind of want to see the associations, and it's really commonly associated with trisomy 21. So that's really something you want to look out for. Don't miss these key points. Another one that's super commonly tested is slept capital femoral epiphysis, which is what you see here in this imaging, where you see kind of like the head, femoral head kind of slipping off, kind of akin to like an ice cream scoop falling off the cone is what you'll commonly see the comparison being made. It's common in the peds section, usually in adolescence, and one of the big risk factors is obesity. And you always want to surgically manage it. You want to put like a pin or something like that. So when you come across an exam and you see like this picture and you see kind of like this clinical picture here, the answer will be surgical management. Some other things like avascular necrosis will be more conservatively managed.
All right, another thing that you may find in your exams is neonatal respiratory distress syndrome. On x-ray, it looks pretty similar to adult respiratory distress syndrome. But again, for neonates, remember this pathophysiology is around surfactant deficiency, and that causes lung collapse. And what that will look like on a chest x-ray is those bilateral ground glass opacities. And essentially that just means you'll have haziness on both sides of the lung field. So as you can see, it looks pretty bad and pretty white on the left image, but on the right image, we have normal air-filled lung field. So just be on the lookout for this and know it looks pretty much the same in the adults as well. Next, we have congenital malrotation with midgut volvulus. Remember normal physiology and embryonic development, the midgut will rotate 270 degrees counterclockwise, and when there's a failure in this process, then you'll have some congenital malrotation, and that is prone to give you volvulus, which can be an emergency because it can cause your bowels to die. So on small bowel follow through or upper GI series, that's how you're going to diagnose this. You'll see that corkscrew pattern right around the duodenum or pretty much anywhere in the midgut. Pretty obvious when they give you the upper GI series or small bowel follow through. So something that may be a little less common than the other ones, but should be easy to spot if you see it. And then lastly, we have necrotizing enterocolitis, or NEC for short. Keywords, if you're hearing bilious emesis or bloody diarrhea or hematochezia in an infant, then be on the lookout for this. It usually is going to be around the first 2 weeks of life that infants will present with this. And then your key imaging findings are going to be that pneumatosis intestinalis or portal venous gas in some cases. So on the right image, we have a normal abdominal x-ray, but on the left you see that pneumatosis intestinalis, which pretty much looks like an outlining of gas around the bowel walls, and you'll see some air bubbles as well. So look for that sort of outlining pattern, and remember, this is definitely a surgical emergency, so if that's an option, definitely choose that. All right, hope this helped, guys.
All right, see you all for the next one. Take care, and good luck on all your exams.